Good morning. I am Taylor Burton, and I'm interviewing Annie G. Fox, a heroic nurse from the horrible day, December 7th, 1941, the Pearl Harbor attack in Honolulu, Hawaii. Hi, Annie. How are you?
I'm good. How are you?
I'm great. Thank you. So today we're going to ask you a series of questions from the attack, and so we can get started. What was the environment like in the hospital the morning before the attack?
Okay, so it was quiet because it was a Sunday. There weren't that many people in the hospital. Most families were at church or with their families, so it wasn't there weren't that many people there.
How many nurses were in the hospital versus the amount of patients you had once the attack occurred?
There were, I think, 6 nurses in this hospital, and there was space for 30 beds, so the ratio to nurses was a lot less than the amount of people that were needed to be helped.
Wow. How long did it take for you to realize that an attack was happening?
It only took us a couple minutes to realize, but it was such a traumatic event, so it was we were in shock.
Mm-hmm.
And the bombs were being dropped so close to the hospital, so it was pretty evident that
it was happening.
Yeah.
How did the workers react to the bombs?
They were really quick to respond. They just jumped into action immediately. They were really, brave and some great first responders. And I remember that I was terrified that a bomb was going to hit the hospital.
What were the type of wounds that people were dealing with?
It was mostly abdomen, chest, face, arm, and leg injuries. It was honestly though a wide variety of injuries.
Mm-hmm. Did anyone else from the area come and help the nurses in the hospital? Any citizens or anyone?
A lot of wives and other children wanted to come and help because some of their injured husbands or relatives were in that hospital, and they wanted to do whatever they could to help.
This is kind of a personal question, but was there ever a time when you were working with a patient and you had to move on to someone else because their injuries were too severe and you couldn't save them?
Yeah, and it's really sad to look back on that, but we tried to save as many people as we could, and we obviously couldn't save everyone. So
did you receive any awards for your courageous acts on this day?
I did actually receive a Purple Heart, because at the time, in order to receive one, you did not have to be injured. And then when they changed the rule, it was changed and replaced with a Bronze Star.
What was your position, and what hospital were you at the day of the attack?
I was first lieutenant, and I served as the chief nurse in the Army Nurse Corps at Hickam Field.
Wow. Did the nurse corps grow after the attack on Pearl Harbor?
Yeah, it grew pretty rapidly, actually. During the attack, there were only 1,000 in the whole nurse corps, and at the end of World War II, there were over 59,000 workers that actually...
Wow.
Yeah.
What exactly is the Bronze Star? You said you received the Bronze Star, so what exactly, did that mention?
Okay, so the Bronze Star Medal, unofficially the Bronze Star, is a United States decoration awarded to members of the United States Armed Forces for either a heroic achievement, heroic service, or a service in a combat zone.
That's really, well, congrats for receiving that. Does anything surprise you when you hear people talk about Pearl Harbor today?
One thing that constantly runs through my mind whenever people talk about Pearl Harbor is that they only seem to talk about the men, which is interesting. Not many people talk about the women and nurses who really risked their lives and responded so quickly to what happened, and I feel like they should be talked about more.
Was it difficult to find nurses to work for the nurse corps?
Yeah, because prior to 1943, women could not be in the military once they were married, but then that law changed, and it was still strict for women. If you had a child, you could not be in the military.
Okay, so what you're saying is if people got married in the past, they weren't even allowed to be a nurse?
Yeah.
Dang. What would you tell people to take away from your experience and just the attack on Pearl Harbor in general?
I would just say to like really try not to take for granted what you have and to like be more grateful for what you have, because there's like so many instances where you can lose someone like in the blink of an eye, and it's just really eye-opening. So you should really just, you know, take that into consideration and be more grateful for your loved ones.
Well, thank you so much for joining us today and sharing your story about this horrific day that no one will ever forget. So thank you so much.
You're welcome.